Hi, I'm Amanda. I'm going to be your PA student conducting your neuro exam today. I'm going to start by washing my hands and have you remove your shirt, shoes, and socks. I would perform a mental status exam at this time. Now I'm going to start by testing nasal patency. So I'm going to have you plug one nostril and breathe in with the other one. And now plug the other nostril and do the same thing. Now I'm going to start my cranial nerve test by testing cranial nerve 1 olfactory. So I'm going to get 2 different scents. I'm going to have you close your eyes, plug one nostril, and now breathe in lightly just so you can smell.
The glossopharyngeal nerve,
yeah.
cranial nerve 10, which is the vagus nerve. So
and now keep your eyes closed. With the other nostril, I'm going to have you smell this.
Coffee.
Yes. Okay. Now I'm going to test cranial nerve 2 optic. So I'm going to have you test your visual acuity with this Romberg chart. I'm going to have you hold it at an arm's length, cover one eye, and read the smallest line you can.
5, 6, 3, 2, 9, 7.
Okay, now hold it with the other hand, cover the other eye, same smallest line.
5, 6, 3, 2, 9, 7.
Alright, and now with both eyes.
5, 6, 3, 2, 9, 7.
Okay, and I would perform this with and without corrective lenses. I would also have patient test distance visual acuity with a Snellen chart at this time at 20 feet away. Now I will test cranial nerve 2 and cranial nerve 3 ocular motor. I'm going to start that with pupil dilation, so direct and consensual. I'm going to just look at me. And consensual. And now direct.
Everything feels normal. So now we will move on to testing your motor strength and the associated nerves with that. Whenever you feel my hands, just push against.
Oh, I'm also going to test cranial nerve.
So first checking.
It's 2. Oh yeah, 2. I'm going to have you move your legs this way. With gross confrontations, I'm going to have you put your hands like this and point when you see my fingers come into your view.
Elbow extension, C6, C7, C8.
Look straight at me.
C6, C7, C8.
Okay.
C6, C7.
Now I'm going to.
C7, C8.
I did. So now it's.
Oh,
okay. So now it's cranial nerve 2 and 3. Okay, 2 and 3. I'm going to test your pupillary convergence. So I'm going to have you just follow this pen all the way into your nose. And now testing cranial nerve 3 and cranial nerve 6 abducens. I'm going to test your oh, I think it's the other way around. Yeah. Okay, accommodation was cranial nerve 2 and cranial nerve 3. So I'm going to have you look at a point behind me on the wall and look at the pen when it comes into your line of view. And now convergence is cranial nerve 3 and cranial nerve 6 abducens. So I'm going to have you follow this pen all the way into your face. And now I'm going to test your
Extraocular H.
Oh yeah. And your extraocular movements is testing cranial nerve 2, 3, and 6. No, 3, 4, and 6. Okay, so I'm gonna have you follow this pen with your eyes only.
We are going to. What are we doing after this? Oh, that's right. Now I can test your sensory. So now, if you could please close your eyes and let me know both sides feel the same. Starting with.
Okay, and now I'm going to conduct a diopter test. So I'm going to start with the diopter at 0 first. I would dim the lights. I'm going to turn on the light and test it on my hand and adjust the diopter to my view. I'm going to first assess midline. I'm going to have the patient look at me for corneal light reflex. Now I'm going to step 15 degrees, about 15 inches away, to assess red light reflex. And now I'm going to get close to the patient with my right hand and right eye and her right eye so that I can assess
sensory testing.
the condition of the retina.
So keep your eyes closed and let me know where your finger's pointing out.
The condition of the retina, the veins and arteries of the retina, the cup to disc ratio and the margins of the retina, and then I'm gonna have the patient look directly at me so I can assess the macula and the fovea.
Now keep your eyes closed, please, and tell me what you
Perfect.
feel on your nails.
Keeping my finger on the dial through the whole time. Now I'm going to assess cranial nerve 5, trigeminal. I'm gonna start by having the patient clench her jaw together and palpate the temporalis and the masseter muscles. Now I'm going to, you can unclench your jaw. Now I'm going to test light touch in the 3 areas of the trigeminal nerve. So close your eyes. Does this feel the same as this? Does this feel the same as this? Does this feel the same as this? Okay. Now I'm going to test cranial nerve 7 facial, and this is 5 and 7. I would test the corneal blink reflex, so I would touch the patient's eye with the cotton ball. Now I'm going to continue to test cranial nerve 7. I'm going to have you close your eyes and try to keep them closed while I try to open them. Good, you can open your eyes. Now I'm going to have you raise your eyebrows. Now frown. Now smile. Now show me your teeth. Now puff out your cheeks. Now purse your lips and try to whistle. Yeah, okay. Now, I'm gonna test cranial nerve 8. Is that hypoglossy? Oh, vestibulocochlear, yes, by doing a whisper test. So I'm gonna occlude one ear for you and I'm gonna whisper a 2-syllable word. I'm gonna have you repeat the word back to me. Are you ready?
And
Baseball. Baseball.
Good job. Now I'm gonna be testing cranial nerve 9, glossopharyngeal, and 10 vagus. So I'm gonna be testing the patient's gag reflex bilaterally. I would open your mouth, test your gag reflex. Now I would use my tongue depressor to press down patient's tongue and look with a light to test, to now test cranial nerves 9, 10, and 12 vagus. Wait, hypoglossal, that was yeah. So I'm gonna have you open your mouth, say ah. I am assessing the rise of the soft palate as well as the phonation of the patient's voice. Now I will test, cranial nerve 10 and 12. Is that your tongue? No, that's glossopharyngeal. Just 12, okay. Cranial nerve 12, I'm gonna have you stick out your tongue, move it back and forth, side to side. Now put it back in your mouth and push it against my hand and over here. Testing the strength, symmetry, and position of the tongue. Now I'm gonna test cranial nerve 11 spinal accessory. So I'm gonna test your trapezius. I'm gonna have you push up against my hands. And now I'm gonna test the SCM by having you press your face against my hand, press your face against my hand. And I think that concludes my cranial. Oh yeah. Wait, and that's also 12? Okay, cranial nerve 12. I'm gonna test your speech by having you repeat to me, no ifs, ands, or buts.
No ifs, ands, or buts.
Okay. Now I'm going to move into. Is it strength? Okay. Now I'm gonna move into the strength exam. I feel like I'm pretty in between. Okay. So I'm just gonna place my hands at different points on your arms and legs, and I'm gonna have you push against them. So.
Oh no.
Yeah. I'm just gonna assess your arms and your legs for muscular atrophy and bulk. Also for muscle tone. Now I'm going to assess your muscle strength. So we went over how we're gonna do that.
Yeah.
Okay. Okay, I'm gonna have you press against me. So this is gonna be C5, C6. Now press in, C6. Now I'm gonna have you press up, C5, C6. Now press down, C6, C7, C8. Now press down with your wrist, C6, C7, C8. Press up with your wrist, C5, or no, C6, C7. Now I'm gonna have you grip my fingers. That's C6, C7, C8, T1. Now I'm gonna have you spread your fingers. I'm gonna try to push them together. Don't let me do it. This is C8, T1. This is testing with the ulnar nerve, and I'm gonna have you go like this. Don't let me break the circle. This is also C8, T1, median nerve. And now I'm gonna have you, wait, this is later. That's it, right? Your legs. Okay. Okay, now I'm gonna have you press up against me. L2, L3, L4, L2, L3, L4. Now press your legs against me. L2, L3, L4. And now I'm going to put my hands in here and have you press in towards my hands. L2, L3, L4. Now press out. L4, L5, L6. I'm gonna put my hands under here, have you press down. L5, S1. L5, S1. I said L6, I meant S1. Now I'm going to have you pull in. L4, L5, S1, S2. L4, L5, S1, S2. Now I'm going to have you dorsiflex, so press up against me. That's gonna be L4, L5. And then I'm gonna have you press down. That's S1. And then I'm going to have you flex your toes up against my push. That's L5. Yeah. Okay, now I'm going to test your light touch. I feel like I'm So I'm gonna use this tiny wisp of a cotton ball to touch on different areas to test your light touch on your cranial nerve. So I'm gonna have you close your eyes. This is testing C1. Does this feel the same as this? Mm-hmm. It is not C1. We'll start with C5. Yeah. Okay. C6. Does this feel the same as this? Mm-hmm. Uh-oh. And does this feel the same as this? Mm-hmm. Okay. Does this feel the same as this? Mm-hmm. That was C7. Oh no. Yeah, C7. And then C8. Does this feel the same as this? Mm-hmm. And then T1. Does this feel the same as this? Mm-hmm. T4. I would rub on the nipple line. Does this feel the same as this? Mm-hmm. Now I'm going to have you pull your shorts down a little bit. Thank you. This is T10. Does this feel the same as this? Okay, now I would do this part maybe under clothing. This is T2. Does this feel the same as this? T3. Here, I'm gonna have you put your hands down to your side. Does this feel the same as this? Now, this is L4. Does this feel the same as this? Mm-hmm. And then L5, does this feel the same as this? Mm-hmm. And then S1, does this feel the same as this? Yep. Okay. And now I'm going to test your position sense. So I'm gonna have you keep your eyes closed and give me your hand. I'm gonna wiggle it up and down, and I'm gonna leave it either up or down, and I'm gonna have you tell me what position you think it's in. Are you ready?
Up. Down.
Okay.
Down. Up.
And then I'm gonna do the same thing with your toes.
Down. Up. Down. Up.
Okay. Now I'm going to test your, I don't remember the word. It starts with an S. Huh? No, the graphia one and the osteognosis. Okay, I'll do that now. Okay, I'm gonna test for vibration and pressure sense. So I'm gonna touch your finger with either vibration or pressure and let me know which one it is.
Pressure.
Yes.
Vibration.
Yes.
Vibration. Pressure. Vibration. Pressure. Vibration. Pressure.
Now I'm going to test your stereognosis. So I'm gonna have you keep your eyes closed. I'm gonna place an object in your hand and I'm gonna have you tell me what the object is.
Tongue depressor.
Yeah. What's this?
Cotton swab.
Yeah. And now I'm gonna draw a number in your hand while you keep your eyes closed, and I'm gonna have you tell me what number I wrote.
4. 3.
Good job. That was testing, not agraphia.
Diagnosis. No, agraphia.
Agraphia?
Yeah,
Okay.
I think so.
Now I'm going to test reflexes. I don't think we have one, so I'm just gonna pretend.
That's fine.
I'm not gonna actually hit you, but all of our
broken.
mallets broke, so we're gonna pretend this is a mallet. Let's use this side. Okay, so I'm going to first test the reflex of the biceps brachii. So I'm gonna have you flex, so I can find the tendon. Now relax. This is C5, C6. Okay. Now I'm going to have you relax. This is biceps brachii, also C5, C6. Now C6, C7, triceps tendon. So I'm gonna have you just relax, relax. Oh, and I would perform these bilaterally. And now I'm going to test the patellar reflex. So this is L2, L3, L4. Now I'm going to test the Achilles reflex. This is L5, S1.
S1.
Oh, just S1. And then that's the last reflex.
Plantar.
Oh yeah, and now put your foot, I'm gonna just hold your foot up like this, and I'm gonna test your plantar reflex. This is assessing L5, S1.
I didn't close my eyes.
Oh, that's okay. We don't have a real mallet, so. Now I'm gonna test your fine motor skills, movements, coordination. I'm gonna first start by having you, is it this first or finger? Okay. I'm gonna have you reach out at a full arm's length. Okay, now touch your nose, touch my finger, touch your nose, touch my finger, touch your nose, touch my finger. Okay, now other hand. Finger, nose, finger, no. Okay, wait, now go with that hand. Now close your eyes. There we go. And now the other one with your eyes closed. There you go. Good job. Now I'm gonna have you twist your hands like it's a light bulb. Now finger to thumb, all your fingers. Okay. Now I'm gonna have you tap in my feet really quick. Oh, I forgot to do the reflex of your stomach. Okay, I'm gonna have you lay down for a second. Again, pretending this is my mallet now. I'm gonna test the reflex of your abdomen. So this is T8, T9, T10 above the umbilicus. Does that feel the same as that? Oh wait, that's not this. Okay, and then T10, 11, and 12. Okay. Now I'm gonna have you stand up and do stance test. Now I'm going to position myself so I can catch my patient, have you close your eyes, Romberg test. Now put your hands out with your palms up, no pronator drift. I'm gonna push your arms down and try not to let me do it. Checking movement. Okay, now you can open your eyes. I'm gonna have you walk to the whiteboard normally. Now I'm gonna have you turn around and walk to me, heel to toe, look at me. Now I'm gonna have you turn around, look at the whiteboard and walk on your heels. And now you can turn around, walk to me on your toes, look at me. Good job. Now you can jump on one leg, other leg, both legs. And now sit back on the bed and do a a heel to shin test. So run your heel all the way from your knee down to your foot. Okay. Good job. And that concludes my exam.